Good evening, everyone. I'm Dr. Anjali, working as an IVF specialist at Indira IVF Prayagraj. The topic for today's discussion is low sperm count. So, whenever any couple is coming to us for infertility evaluation, then we generally do the evaluation of both husband and wife because it has been seen that in around 30 to 40% of those patients who have infertility, it is a male factor which is actually contributing to it. The first step of evaluation of a male partner would be a semen analysis. So, semen analysis is generally done after an abstinence of 3 to 5 days, in which we tell the couple to collect the semen sample in a white mouth container, which should be sterile, and it should be collected in a semen collection room, not in the washroom, and it is generally collected by masturbation. So when we analyze the sample, the andrologist is analyzing the sample, then we generally check the count, the sperm number, the total number of sperms. Then the motility of these sperms, the progressive motility is very important, and the morphology, which is the shape and the size of the sperms. So, according to the latest WHO criteria, the normal sperm count should be more than 15 million. The morphology should be more than 4%. At least 4% sperms should be normal in their size and shape. And the motility, the progressive motility, should be at least 40%. So, what is a low sperm count? Whenever the count of the patient is less than 15 million, then we generally label it as oligospermia, which is the count is less than 15 million. Sometimes the motility is also very less, it is less than 40%. Then we term this thing as asthenospermia. And when the morphology is defective, the sperms have defects, they have head defects, they have neck defects, then we term this as teratospermia. Sometimes the sperms are having multiple issues, like they are low in count, the motility is also less, the morphology is also affected, then we term this as oligoasthenoteratospermia. So, low sperm count, then if any couple has a low sperm count, then we generally take a detailed history of the male partner. For example, if the couple is suffering from any prolonged illness, any fever in the recent times, then we have to recheck the sample after a gap of maybe a month or two, because spermatogenesis is a continuous process. It takes around 72 days, and the sperms, they basically the count and motility, it varies from time to time. So just based on the one report, we generally don't start the treatment. We take a detailed history, then we also examine the patient, which is generally done by a urologist. We have to see the size of the testes, the consistency of the testes. We have to look at the general features of masculinity, for example, the beard pattern, and then the voice of the patient, basically everything which is related to the masculinity that we have to check. Sometimes some patients have very low features of masculinity, like their voice is not very masculine. They have very sparse hairs on their face. So these patients generally have very low hormone levels, and that is contributing to their male infertility. So, if the patient is having a low sperm count, then we have to do the examination of that couple, and we have to do further advanced checkup for those patients, in which generally we have to do the hormonal profile of such couples, in which we have to do certain hormones which basically are responsible for the spermatogenesis, for the sperm production. So these hormones includes your FSH levels, LH levels, testosterone levels, estrogen levels, and other hormones like prolactin and thyroid. And based on the reports of these hormones, we generally then start their treatment. The initial treatment in any case of oligoasthenospermia is we give them antioxidants. These antioxidants basically contain selenium, vitamin C, coenzyme Q, and they basically act at different stages to improve the count and motility, because oxidative stress is considered to be a major factor leading to oligoasthenospermia. Sometimes we after even after doing all the evaluation, we are not able to find out a cause that is termed as an idiopathic oligoasthenospermia. So in these patients, if the count is less than 10 million and the motility is less than 30%, then we generally advise them to go for an IVF cycle. If the count is more than 10 million, motility is more than 30%, then they can also go for 1 or 2 cycles of IUI, which is intrauterine insemination. So IUI is a very simple procedure in which we basically stimulate the female partner. We give her some medicines and few injections so that she's able to produce more than one egg, and then we take the semen sample of the partner. We process it. We basically remove all the क्या कहते हैं all the dirt and then we put the good quality sperms directly into her uterine cavity. So these chances of having a pregnancy after an IUI cycle are around 15 to 20%. And if there is a male factor, mild male factor, then we can generally advise them to go for an IUI, provided the female partner is having all her investigations to be within normal limits. Sometimes the count and motility is very very low. It is less than 5 million. It's occasional motility and the morphology is very poor. In these group of patients, generally we advise them to go for an IVF, and in that IVF cycle we have to go for an ICSI. So ICSI is an advanced method of fertilization in which we basically pick up the sperms based on their morphology, and we pick up all the good quality sperms, and then we inject sperms directly into the oocyte, and we basically then see their fertilization and their embryo quality. So if any couple is having a low sperm count, then that definitely needs further evaluation and definitely needs treatment, because these patients they are not able to conceive naturally. They need to go to a fertility specialist and they have to get themselves evaluated. They have to do their hormonal profile, they have to do their examination, and then based on the reports, based on the treatment, after treatment of 2 to 3 months, if they don't conceive, then they have to go for an advanced fertility treatment, maybe an IUI or an IVF. So that's all in cases of a low sperm count. If any couple is having such report, then they can come to an nearest Indira IVF fertility center, and they can get themselves evaluated to see the reason why they are not able to conceive. That's all. Thank you for your patient listening.